like it. Ladies, if you're wondering what the heck is happening to your body and libido, our next guest, OBGYN and Chief Medical Officer of Body Logic MD, Dr. Jennifer Landa, offers the solution. Now, it's very common for women, especially over 40, to lose their sex drive, and the book, The Sex Drive Solution for Women, says this is real-life mojo for the modern woman. So, Dr. Landon, welcome.
Thank you.
And what does your book offer for women as far as sex is concerned?
Well, like you said, so many women lose their sex drive. They're definitely not alone if that's what's going on. 1 in 3 women will lose their sex drive. And so
Yikes.
Yeah. So one of the things that really we need to focus on is the fact that we can have our sex drive back, and better than ever. But just like we need to watch our food intake and exercise to be thin, there are certain practices we can do when it comes to keeping our sexual mojo up.
What are some of those? We've talked about this earlier.
Yeah.
What are some of those practices? What can women look forward to doing to change this problem?
I think one really big thing we need to do is take control over our stress. And one way to do that is by being mindful, using mindfulness. So one of the things that most women have experienced is when you're trying to have an intimate moment, all of a sudden you're thinking about your shopping list or what you have to put in your kid's backpack for the morning, right? So if we engage in the practice of mindfulness all day long, just when we're eating a meal, really tasting the food and paying attention, then we can do a better job at employing those techniques in the bedroom as well to really focus in.
That's in the bedroom, Dr. Jen. That doesn't explain the sex drive. That's when you get to the bedroom, now focus on what you're doing. But how does a woman raise her actual sex drive before?
Well, that was my question. Is it more in the mind or is it more in the body? Like, is it more hormonal or is it more like, I'm just stressed out?
So 98% of sex, I would say, really starts in the brain. So being able to be mindful in any situation will translate to an ability to decide. Most women want to be sexual, let's face it, for emotional intimacy, right? So it's really a decision to want to engage in sexuality.
Why do some women who are in their 40s have really high sex drives and some have none at all?
You know, it seems to be almost like a dichotomy. There's one population of women where it goes up and one where it goes down. One thing that's interesting, you brought up hormones. A statistic that's fascinating is testosterone, the hormone of desire. Women have it too, and it's really important for their sex drive. 10% the amount that men do, but it's a really important 10% for our sex drive. So we always think about hormones going down in menopause, but in women, testosterone takes the biggest dive from the ages of 18 to 34.
So can women do testosterone practices? Can they do testosterone practices to raise their
I
libido?
do in my practice a lot of testosterone
Without growing
therapy.
a mustache?
That's going to be that key. No
of it.
mustache.
Absolutely. Yeah, so you can't take a guy's testosterone gel because you will grow a mustache, absolutely, but we can give it to women in certain doses that are appropriate for women. But other things women can do to jack up their testosterone, we've all heard of like burst training, high intensity training, weight training. Those things will boost your testosterone in the gym, whereas cardio will actually decrease your testosterone. So that's something
That is
important
very
to know.
interesting. And Dr. Jen, for the guys, guys with low sex drive, help them out here. Give them a little advice before we move on. It's not, no.
Keep it for the girls. Don't worry, our sex drive is fine.
Let's help the guys out.
So the biggest problem that guys seem to have as far as sex is concerned, ED, erectile dysfunction. And what's really important to know about this is it's a lifestyle disease. Just like we're talking about obesity and diabetes, ED is coming out as one of the biggest risk factors for cardiovascular disease. So if
That's
you've got
an interesting correlation.
It is. It is. And there are studies to show
hypertension is a big one.
Absolutely. So if they follow a Mediterranean diet and stop smoking, of course, if they're smoking, all the things we need to do to reduce our heart cardiovascular risk factors will improve our men's erection.
We want everyone to make more
Thank
love.
you so much. Yes, absolutely. Well, Dr. Landa's book is available online. Go to our social media pages for more information. Thank you so much, Dr. Jen.
Thank
Appreciate
you.
it.